Good evening. A Twin Cities nurse is out of a job after she allegedly used the same syringe on multiple patients. Allina Health says that the nurse worked at a dermatology clinic at Bandana Square in St. Paul. And since October, more than 160 patients may have been impacted. John Lauritsen shows us the concerns Allina and the patients have.
Definitely, it's surprising to hear. Yeah, it's definitely not something that you expect to hear, especially in our own backyard here.
Dr. Mark Bergstrand says patient safety is a no-brainer in his line of work. Anything less could put him out of business.
So we always use a clean syringe and needle with each patient,
which is why he makes sure his staff takes all the necessary precautions.
We start by opening the syringe. We would expect anybody working in the healthcare setting, even at the lowest level, to have good, clean hygiene and understand the need to use a new syringe with each patient.
But Allina Health says a nurse practitioner at a dermatology clinic failed to do that. They say she used a new sterile needle for each patient, but in some cases used the same syringe on several patients.
Some of the blood from one patient could get into this syringe and then could expose the next patient. So we worry about transmission of bloodborne infections, things like HIV or hepatitis, particularly hepatitis C.
Allina says the nurse responsible is no longer working there. And in a statement, they said, "We believe the risk of infection to these patients is very low." However, Allina is contacting 161 people who received an injection by the nurse and are recommending they be tested for possible exposure to disease. They will do the tests free of charge.
I would say this is quite serious, and I'm happy to hear that Allina sounds like is looking into it.
Allina Health says they are sorry this occurred, and they say they are doing everything they can to help those affected. They say they are dedicated to patient safety. Standard protocol is to throw the needle and syringe away after they've been used just one time. They say that's something that you learn very early on when you're going to school to become a nurse.
Well, I'm glad the word is out there. They're going to get in touch with the patients. All right. Thank you, John.
You bet.